Hi, I'm Akhilesh Ratnam and I'd love to welcome you to This is Medicine. So, This is Medicine is a webinar series that we're doing to take a dive into different medical specialties to hopefully share some knowledge about what it takes to succeed in them, any misconceptions surrounding them, and how you can maintain a healthy work life balance when tackling a career as stressful as healthcare. So every session we're focusing on one speciality in particular, and these will be the sessions in the future. So we'll be looking at general practitioners, anaesthetists, neurosurgeons, psychiatrists, and paediatricians. But today we'll be focusing on cardiac surgery. So every session will have two guests, and there'll be a pairing of a parent and a child, where the parent is a worker in the medical field. So today I'd love to introduce you to Mr Sunil Bhudia and his daughter Sanjani. So Mr Sunil Bhudia is a consultant cardiac surgeon at London's Harefield Hospital, as well as being the clinical lead, and he is also an associate professor at Warwick, and his daughter Sanjani is a medical student studying at University College London. I'd also like to introduce you to our host Akash Ratnam, who is a medical student studying at King's College London.
All right, so thank you everyone for coming. I know it's been a busy week with the start of the new year. I would, however, like to formally thank Dr. Sunil Bhudia and his daughter Sanjani for joining us today. So let's kick right off. I'd first like to ask you, sir, how did you get from the point of just being a child interested in medicine to where you are today, wildly successful surgeon?
Sure. Thanks, Akash, and thanks, Akhil, and thanks, Sanjay, for prompting all this. Well done for you all to start a series like this, and hopefully by the end of the series, you will have inspired some sort of prospective doctors, and also put away some misconceptions of medicine and especially cardiac surgery. So we will start off. I was born in Kenya. I wasn't born in UK, and none of my parents or anyone in the family is a doctor. So I'm the first doctor in the family. So when I was growing up, I'd never thought of medicine as a career because it was one of those things that was out in the sky. No one could get to becoming a doctor. However, we just carried on, and at that time, I was quite interested in mathematics. So I thought I'll become an engineer. Most of our family members are in engineering. Nevertheless, we emigrated to UK just after I'd finished my A levels, and we in Kenya we follow the British system, so it was like for like. So we finished my exams, and I was here with the whole family. I'd got a place in Manchester to do. To become an optician, but that wasn't something that I was interested in. It's just as a backup, I'd got an admission into becoming an optician because I was coming from an overseas country. And then someone suggested that, you've got your grades. If you're interested, why don't apply for medicine? And that's how I started. So at that time, we didn't have the laptops and emails and all that. So I had to write out letters to loads of universities, and I wrote to about, I think, 20 universities saying that these are my grades. I'm interested in doing medicine. Very naive, not being prepared for any of these things throughout my A levels or anything like that. But anyway, I'd applied, and I got reply from two universities. One was from Cambridge, and they said, we are interested in admitting you, but we can't. We will give you an admission the following year. So rather than the same year, they were going to give me an admission following year. And then I got a response from UCL, and the professor said, why don't you come and meet us? So I went and met the professor, and they gave me an admission that particular year. So I ended up starting medical school in 1990. I didn't want to wait for another year doing nothing. And wanted to get on and start studying because I wanted to finish quickly on the other side as well. So I gave up the place in Cambridge and started in UCL. And again, no inclination that I wanted to become a cardiothoracic surgeon. I just started a new country, a new environment. So started getting into medical school. Initially, I didn't do my BSc as everyone did BSc. After the second year, about 80% of the students did BSc after the second year. I didn't do a BSc at that time. I thought I'll just carry on because I wanted to finish. But then something told me, there's no rush. Why not do BSc? So I ended up doing my BSc in my 4th year, and I did it in pharmacology because I thought that was a bit more interesting. And I'll tell you, it helped me later on when I was doing my MD. Things I learned in pharmacology, I used that for my thesis later on. So doing a BSc, it's not a waste of time. It can help you in future. So I did that and finished medical school and started doing house jobs. We did house jobs rather than FY1. So things have changed now. So we did 1 year of house jobs. So one in 6 months in medicine and 6 months in surgery. So I did just outside London house jobs. And then I moved to West Midlands. And while I was doing my house jobs, that's the time I got interested in surgery, but still didn't have what surgical field I wanted to go into. Initially, I thought I'll do pediatric surgery because I thought it was quite interesting. So I got into a rotation in West Midlands, which was quite good because you could choose your rotation where you went for your surgical training. And even there's a little interesting history about that. I'd applied for quite a few rotations, and everyone applied for the popular ones in London. But I was quite pleased to get the one in West Midlands. So my first posting was in orthopedics. And then the second posting I'd chosen was in pediatric surgery, but it was pediatric neurosurgery, Birmingham Children's Hospital. And that time I just decided pediatric surgery is not for me because that's not what I enjoyed, though interesting surgery, but I could not deal with parents and children. You're not just dealing with a patient, you're dealing with the whole family. And it was quite a challenging experience because it was mainly in neurosurgery, children coming with cancer. So that just put me off pediatric surgery. And then the next thing I did after that was cardiothoracic surgery as my rotation. I'd never thought of doing cardiothoracic surgery because in my medical school, we had students who wanted to do cardiothoracic surgery, and they thought that they were the best of the best in the medical school. They were very proud people. And that sort of put me off cardiothoracic surgery. However, I did cardiothoracic surgery as a rotation and found that it was very, very interesting. I really got interested in cardiothoracic surgery, not only from the surgical point of view, but also from the management of patients. So you don't just manage patients on the ward, you also look after patients on the intensive care unit. So when you're going through medical school, you learn about physiology, you learn about anatomy, you learn about pharmacology. And this is one field that I've thought that we are putting all that information, all that knowledge that we've learned together. And you're learning about how the different drugs work. And on intensive care unit, you can see the responses and all that. And so you're not only managing patients medically and making decisions, but you're also doing a surgery as well. Doing cardiac surgery, the types of operations you do, or number of types of operations you do are very narrow, but they're still quite complex operations, long operations. And that sort of got me interested. And then I started looking into how to get into cardiothoracic surgery. And I started talking to various people in West Midlands. I started talking to people who were in decision-making positions, who were able to, who are choosing the registrars and all that, to see what sort of qualities you need in order to get a registrar post. So we used to have what we called a national training number, which were allocated to various regions, and you had to compete for that. And I was told that in order to be competitive, not only do you have to do your MRCS exams, you need to pass that. So I did that while I was doing my SHO course. You also then need to have research under your belt, a higher degree, MD. So I started looking at how am I going to get an MD degree. I've come from Kenya to UK, and now do I have to go elsewhere to get MD, do research? So I first started looking in UK, and I wasn't getting any luck with that. And Then I ended up in America, in Cleveland Clinic, which is a well-known, world popular heart hospital, and I went and did my research there. And the sad bit of that was that I was there by myself. So Sanjini is sitting here. She was here in UK. Obviously, she was very young at that time. She was only about 2 years old. And I had left the whole family to go and do research in America, knowing that that's the only way I could get into a training post in UK. So I said that I'd done the BSc. So when I went to America, I thought I'll get a project, which they'll say, here's a project, start doing some experiments and come up with papers, and you can write up your thesis. When I went there, I was told, here are some folders, and come up with an idea as to what do you want to look into. And I thought, oh, this is very unusual. It will take me another 6 months to even start thinking about starting a project. However, just spent lots of time in the hospital and went through all these folders, and it was about neuroprotection in cardiac surgery. That was a sort of a common topic that people were looking into, because during cardiac surgery, loads of patients end up with short-term memory loss, they end up with some soft neurological problems. So we wanted to look into that, how you can prevent that. So I started looking into that, and that's where my pharmacology helped me, because there are some receptors in the brain that have magnesium that blocks that receptor. So came up with an idea that if we give magnesium to these patients, can we protect the brain? So cut a long story short, I wrote up a protocol, spoke to many people, and then I started the research. And so I did a randomized trial with 350 patients, and I finished that and then came back to UK. But before I came back to UK, I had to apply for a registrar post, a national training number, which was advertised in West Midlands. So I managed to get into that. And then after that, we had the 6-year training. Well, the 6 years training, it's normally a 6-year training, and then people tend to extend it. So during that training, I wrote up my thesis, and then started taking on some extra roles. So I started getting roles, and I took on a national training representative in the SETS. So that's the Cardiothoracic Society. And that's how I started getting into the society, started expanding, not only doing working as a doctor, but also working outside. And I think that's healthy, not only for your own sanity, but healthy for the family and everyone, because then you're taking yourself out and you're not always thinking about surgery, your work, and all that. And also during that time, we set up a charity. We didn't set it wasn't a charity body, but we started charity work in Kenya, where we used to go out and do some operations on children, underprivileged patients, and give something back. So these are extra things I started building on top of the work I was doing. And I was fairly fortunate that just at the time of my training, completion of my training, exactly at 6 years from when I started, I got into a consultant post in Coventry, and then got into consultant post. And my mind works in the way that when I start something, I say, oh, can we do something differently? So I was always looking at how I can improve the pathway for patients. How can I improve the experience for patients? How can we improve the education of junior doctors? So that's how I started getting more and more involved in the education part of junior doctors, and then also in the management and leadership of the hospital. So I became a clinical lead in Coventry, and then family were always in London. And at the back of my mind, I always thought this is not a healthy way of leading a life, not only for myself but for the family, because you don't want children growing up with father not always being around. So I was always looking to get back to London, or move the family, but I think London was a better option for me. So I managed to get a consultant post in in Harefield Hospital, but at the expense initially had to take a big risk and give up the job in Coventry, a substantive post, permanent post, and took up a locum post in Harefield, which was a risk on my part. But I knew that if I kept my head down and worked hard, that post will become substantive. And a year later, that became substantive. And then I became a clinical lead at Harefield and carried on. And throughout this period, I was also an honorary associate professor at Warwick Medical School. So I've been helping at Warwick Medical School. I helped with their curriculum change and also go there for the selection of medical students. However, more and more I started getting interested in the leadership aspect. How can I influence what we do for the patients, not only the ones we operate on, but in a bigger picture, getting patients in, giving them the best experience, and becoming more and more patient focused. So that's how I started getting into leadership, and I wanted not to carry on in my leadership role without knowing, having theory behind it. So when we do surgery, we have quite a lot of theory. So same principles apply to me, that if I want to go into leadership, I need to have some theory behind it. So 2 years ago, I started executive MBA at Imperial, and I just finished that in December, waiting for the results. So now I have the theory of leadership, and now I know that I can apply that in my leadership roles that I have I'm increasingly taking in the National Health Service, but also got some roles in our National Cardiothoracic Society, where we have been involved in education and now in some sort of a meeting organization. So in that sort of, I've taken you from my journey through medical school, but other things that I've done in order to increase, not only buff up my CV, because I think that's the wrong thing to do. You don't want to just improve your CV just for the sake of progress, but you're improving your CV in areas where you are enjoying yourself as well, so that if someone did ask me about things that on my CV, then I'm quite passionate about it and I can talk about it, rather than just saying that was a box ticking exercise. I know it takes a little bit longer to buff up your CV that way, but I think that's probably a more satisfying way of doing things. And I think that's the summary of my journey so far.
All right, I'd just like to say, I think the word that could really sum up this journey is perseverance. When I heard about how you had to go to America to do research at the Cleveland Clinic because that's what you wanted to do, or leaving a permanent job in Coventry for the sake of your family, it really embodies the sheer grit that you have to succeed in this field, while also keeping everything else intact. Because what's the point of losing everything else as a cost? That's how I would look at it personally. One question I would like to ask, though, as a lot of our viewers are prospective students, what is cardiothoracic surgery? You talked about how you got there, but can you talk a little bit about how I would get there, or how our students would get there, as the journey has changed quite a lot since then?
Yeah, that's a very important question, and certainly the journey has changed. And when I was going through that process, the journey was not sort of signposted, and it wasn't. It's become very rigid now, so you know exactly from the time you're in fact, when you're doing A levels and you want to go into cardiothoracic surgery, you can map your journey through all the way. In some ways, that is very good. At least you know what you have to do, what you have to achieve in order to get to that to the goal. However, it can also prevent you from exploring other aspects of medicine as well, because now medicine has become even more exciting. You know, like there's the There's the artificial intelligence. You can go into loads of things. There's all the digital stuff that is coming through, which when we were going through the medical school, that was never an option. So if you narrow your option from the time you're in A levels, and you come into becoming a doctor, you become a registrar, and you go into surgery, you may have excluded some other thing that you may enjoy. So in some ways, it is good that it's quite a rigid structure, but you also need to be mindful that you also open up and experience other things as well along that journey, just in case there's something else that sort of takes your interest. But once you have made that decision that you want to go into cardiothoracic surgery, even at A levels, then you start acquiring some of those skills and some of those things into your CV, because they want to what we are looking for. In fact, next week we will be interviewing prospective candidates into coming into training. So these are into a core training. They could be finishing core training, but they're coming into the specialist training of cardiothoracic surgery. So what we are looking for now is, do they have commitment? And how do they show commitment? Is that, have they done electives related to cardiothoracic surgery, into the related to cardiothoracic surgery? So we would expect them to have done 2 electives in cardiothoracic surgery while they're in medical school. Along that journey, have they published anything? Have they participated in audits? Have they participated in quality improvement projects? These are things that one needs to undertake and start building up their portfolio, so that when they come to applying for the cardiothoracic surgery course, they've already scored quite a lot. However, it is very important that they go and experience cardiothoracic surgery not only as medical students, but also as doctors, and spend some time, because it may sound exciting to some people, or we are dealing with the heart, dealing with the lungs, dealing with the major arteries. Well, this is exciting stuff. However, you need to go and experience that. And quite a lot of hospitals, certainly our hospital, if people approach us when they're in A levels or even in medical school, we invite them and spend a couple of weeks with us so they can see what's involved. And I must say, I've had a few people who've come through that and say, you know what, I really wanted to do cardiothoracic surgery, but after spending this time, it's not what I was expecting, and they look for something else. We've also had A-level students coming to us who are very keen on doing medicine, and they come and experience some time with us and say, you know what, this is not something for us. But what we do is we also give them experience in pharmacy, we give them experience in physiotherapy, experience in all the allied healthcare professionals when they come and spend 2 weeks with us. So one of them came in wanting to become a doctor, and then say, oh, this is not for me. And then she ended up becoming a pharmacist. So, you know, things in your head, your perception may not be what is reality. However, the question you asked is, how do you go into cardiothoracic surgery? Then there are quite a lot of signposts. And then the other thing you need to do is you identify a mentor, or someone who will take you under their wings, not necessarily into their hospital, but who can guide you through, go and do this, go and do this, go and meet this person. And perseverance. It's not a short journey, it is a long journey. And just be open-minded. And I think we'll come to it later on, that you also, you need to have other interests besides just being in medicine. That will make you a more rounded person and will take you through your career without, now, you know, the buzzword now is burnout. People who've got other interests, chances of them getting burnout is quite low.
So you also mentioned how you were exploring different fields when you were going into cardiothoracic surgery. So why should people be interested in cardiothoracic surgery? What made you choose cardiothoracic over anything else?
Yeah, so that's very important, because once you make that decision, you then embark on this this career, and by the time you realize that it's not for you, you may have wasted 2 years of your life going down that route, and then you have to come back and pursue another one. So it's the interesting kind of and it's the operations can be complex. They're long operations, so you need to be prepared about that. But putting that aside, because you can do the long operations. Everyone can do long operations. But would you then next day be willing to wake up and still be excited about going back to work? That is the key question. And what is quite interesting about cardiothoracic surgery is that, as I mentioned before, is that not only are we dealing with the surgery itself, which is long operation, or it can be short operation, but it is a fast-moving, advancing field where people are making smaller and smaller cuts in order to achieve the same outcome. So that is one bit that is becoming more and more exciting in cardiothoracic surgery. And the other thing is that you are dealing with patients and you're having to think about anatomy, you're having to think about physiology, you're having to think about pharmacology, and all those things come together, and you can practice all these things that you've learned in medical school in a patient. Not practice in the sense that trying it out, but you're actually seeing the effects of all these things immediately on a patient. The other thing with cardiac surgery is that you can see the difference in patients. They come to you feeling quite symptomatic, so typically they'll be feeling out of breath. But when you see them after surgery, after 6 weeks after surgery, they're completely different people. You get your surgery right, they're completely different people, and they're thanking you because the things that they could not do before, now they're able to do that particular activity. And cardiac surgery, and to some extent thoracic surgery as well, improves one's life expectancy. Not better than normal, but if your life expectancy is reduced because of the illness, and you cure the problem, or you do the surgery, then it helps to bring the life expectancy to back where it was. And that's one of few surgical fields that you're able to do that.
All right, one thing that I really took away from that is just the before and after surgery perspective. You talked about how people can completely change, and therefore it just really shows how life-changing the field really is. One thing I wanted to query, though, is what specifically is the skill set that surgeons have to possess compared to other specialties?
Yeah, so certainly in any surgical field, you need to have the hand-eye coordination. You need to know whether that's something for you. Some people are not able to do that. The other thing is that there can be quite a lot of blood as well, and you find that some people are put off by blood. We've got students who come and they find that the minute they see blood, that's not for them. So putting those things aside, what you need is you need to have the mindset. You need to have discipline in yourself, because these operations can be anything from 4 hours long to almost 12 hours long. And sometimes you're the only person who's been the constant throughout the operation, meaning that you start the operation and finish the operation because you're the person who's in charge. You're the person who's doing the major bits of that operation. So especially in the emergencies, and you'll find people around you are changing. So the nurses would have changed, the anesthetists may have changed, but you are the constant person there. So what that brings in you is you need to be fit. You need to have a mental sort of stamina that you can concentrate for that long. People ask me, how can you concentrate for that long without a break, without going to the bathroom and all that? But you'll be surprised, because you're concentrating so much for this particular operation, you forget about all those things. That is something that you need to be mindful of, and you need to be also and in order to be able to do these long operations, back problems, neck problems is a very common problem that cardiothoracic surgeons face, and other surgeons as well. So you need to see how you'll be able to mitigate that. So you need to have some fitness regime that you can follow. Not, I must say, not all the cardiothoracic surgeons do that, but increasingly that is becoming a well-known factor, a fact, and people are starting to look after themselves as well. So we were just talking the other day, one of our colleagues in a hospital in Birmingham, they take short breaks and they do stretching and all that in the operating theater, which I'd never heard of before, but it is something that you need to think about, that you need to start doing. So you need to look after yourself. So what's the difference between other doctors and a surgeon is that you need to have quite a lot of discipline. You need to be prepared to be called middle of the night to do an operation. So imagine you wake up middle of the night and you have to go in and perform at your best, middle of the night, or at 2 o'clock in the afternoon, or at 8 o'clock in the morning. You have to perform at your best because your surgical skills are going to make a difference to that particular patient. So your surgical skills can't be different at midnight or at 8 o'clock or at 2 o'clock. They have to be the same all the time. And you need to find ways of making sure that those skills would be the same. That's a particular standard level, minimum good level, whenever you're called to perform. So you need to learn some strategies as to how you'll be able to do that. So, for example, if I have to go in the morning or middle of the night to do an operation, I have developed some strategies that I'll make sure that by the time I start my operation, I'm as good as if I'm starting the operation in the morning.
But surgery sounds pretty tough and quite enduring. So how do you maintain that work-life balance?
So as we mentioned before, I think family is quite important, certainly for me. And the distance I spent away from the family, you can see that it starts taking a toll, not only on yourself, but also on the family. So it's important to have a family. And one thing we tend to do is to have family time together. And then the only time we have good family time together is we have dinner. We make sure that we have dinner together, all of us. And at the dinner table, we will discuss anything, we'll have some philosophical topics or whatever, but have that. And that takes your mind off work and all that. The other thing you need to make sure is that you have some activities which are not work related. So I enjoy running. In fact, I'll be running a marathon in April. So that is something that keeps your mind away and keeps it fresh as well. People play music, musical instruments. People go dancing. The last thing you want to do is people make that mistake or get into that trap is drink alcohol, which lots of surgeons, lots of doctors get into that trap. So you need to be mindful of not getting into that trap of comforting yourself with either food or with alcohol. And as we mentioned before, the charities as well. We participate in charity work. In fact, as a whole family, we participate in charity work. Sanjini came with us to Kenya to do some charity work in the hospital. So it's important that you do all these things together, family and also outside of work. Though you may say charity was the work you are doing, but that feeling of giving something back to underprivileged people is completely different than the work that you do. Though even though we are operating, but that feeling is completely different. So there are lots of things you can do, and it's individualized. But you need to find something. Don't say, "Oh, I can only work. This is me." No. Yeah, you get burnout. You need to have some ways to release the steam.
So you mentioned a lot there, sir. But I wonder, how do you find the time to do everything with all of your positions, with all of your charity work, hobbies, and also managing your job. How do you find the time in the day?
So as time goes on, you find that you can delegate quite a lot. So for me, some of the things at work, I need to start trusting other people, that they can do things. I'm not the only one who can do things. I'm not the only person. I need to get away from that I'm the best person. That's not like that, because there are other people who can do certain things. So you need to learn how to delegate, but not abusing other people, but delegate some things. So for example, if I need to go and see patients on the ward, I need to start trusting my junior doctors that they can see the patients and they can come and report back to me. And in that time while they're doing that, I could do some other things. And if I need to go and see a patient, then I can go and see that particular patient for a particular reason. So that's just a small example. So you can start delegating things. And then when you come home, remember, work will still be there. Patients will still be there. If you've done your job well, then that patient will be fine. And then the other colleagues as well who can help you look after patients. Then when you come home, then you have that time with the family. And also as a family, you say, okay, this is what I'm going to do. And these are the things that we will be doing together. It doesn't happen overnight. It's a slow process. But when it comes to, it is important that you have your own time as well, that you can reflect on certain things. So that's why whether you play music, musical instrument, you go to the gym, or you go running, walking, cycling, whatever, that is your time. Even if it's half an hour, it does you a lot good than if you didn't have that time. So you always find time. As far as you start trusting people around you, then you will find time.
That's a really nice way of looking at it, I feel. You need that community to succeed, both as a doctor and as a person. One thing I did want to quickly touch on, going back to the biopic of your life that you gave at the start, you mentioned that when you were looking into cardiothoracic surgery, a lot of the prospective cardiothoracic surgeons had a bit of an ego. They thought they were the best of the best and that nobody could tell them wrong. I thought that was quite interesting, playing into the stereotype of surgeons having a God complex that we often see in the media or hear jokes about. I thought it would be interesting to see how you felt on that topic.
I'll tell you an interesting story about that. When I was a senior house officer, and I went to the surgeon to say, look, I want to become a cardiothoracic surgery, they told me you'll never make it through because you are not the type of person, I didn't go into a room pumping my chest and saying, this is what I want to do. I went there, can I explore the option? And the sort of people who used to be in surgery, and especially cardiothoracic surgery, neurosurgery, thinking that they're better than anyone else. I think though that is going away, but that was due to some insecurities people had. I think that is going away. And if you really, really believe, it doesn't have to be in cardiothoracic surgery. You want to become a neurosurgeon, you want to become a geneticist, or you want to go into artificial intelligence in medicine. If you believe that and that is what interests you, then whatever people say, these are the people who are very proud people. I think they are just insecure people. If you believe in yourself, you believe in your capabilities and do the right things, you will succeed in that particular field. So when I was going through this, people, there used to be consultants who used to come and tell me, you'll never succeed as a consultant in cardiothoracic surgery. But those are the same people who now come to me and say, well done. And I'm actually their lead. You see, I'm leading them. So you just have to believe in yourself, and but don't trample on other people. Don't abuse, don't be like them. Be true to yourself.
And you also have an interest in virtual education.
Yeah.
Can you speak more about that?
Yeah. So now you see, in UK and I think everywhere else, things move at a very fast pace. You know, if I wanted to know what are the causes of, say, coughing up blood, just as an example, you put it on your mobile phone or whatever you are, and you find the causes of it, and everyone gets information very, very quickly. So, and people have not much time in their training as well. So my interest started coming is, how do we train the new doctors and keep them interested as well, because the new doctors are very good with when it comes to gaming, when it comes to being on the internet. And so how do you make them interested in surgery, and can you make surgery virtual? So this idea came to me many years ago, and to see if we can practice some of the surgery virtually, meaning can you practice it outside, and then when you go into the operation, you find the same setup, meaning that you find the organ is the same what you were practicing. So it becomes quicker and safer for the patient. So that's how the idea came. But now more and more companies have got sort of virtual platforms. But the one that interested me quite a lot, which we've not developed it further, is that there was a company that used to look at, say, for example, we look at your, they start off with a picture of your skin, yeah, on your, say, on your hand, and then it starts magnifying, and then it tells you what's the structure of the skin, the structure of that hair on the skin, and then it goes deeper, and it starts magnifying the fat underneath the skin, the vessels underneath the skin. It tells you all the anatomy, and then the histology of that particular organ, and then it even takes you into the bloodstream and tells you what the bloodstream. So these are the things that is possible virtually to learn about things, rather than learning from the books, because when you learn from the books, you have to create a picture in your head. This is already creating a picture, so we are skipping that one step of creating a picture in your head yourself, to this is pictures already created, and you can learn better that way. So these are the ways why virtual education has come or became, we got interested. There's another bit of it's virtual, is how you educate people. Say, for example, we can be fortunate to be able to go to this particular operating theater, this particular hospital, to see what's happening. But imagine a person in an underdeveloped country who doesn't have that opportunity. So you can video the operation in a 360 environment. So then you just have to put, and the person on the other side puts on those 360 goggles, and they can see the whole operation, look around look around as if they are immersed in the operating theater. So this is another way of educating people out in the underprivileged countries, but also how we can educate our future doctors, not only as surgeons, but all the doctors using virtual platforms.
It was interesting to think about the ability to educate people from overseas and underprivileged countries. I just wanted to ask about that. Of course, I can recognize the importance of lifting up our fellow man and fostering the medical community internationally. So I wanted to ask about your charity work in Kenya. Specifically, I wanted to think about what you gave to that cause, and also what you feel you may have received from that experience.
So it's very rewarding. So we've been doing it for almost 15 years, up until the pandemic started, and then it stopped. But again, we're going to restart this year. So the way it started was, we've got the expertise. There's the need in some of the underdeveloped countries. So there was a need of cardiac surgeons in Kenya. And there are loads of patients. You know, we used to get patients, in fact, children who, when you talk to them, all their friends are playing football, because football is a very popular sport in Kenya. All their friends are playing football, but this child can't play football because they're getting out of breath. And this sort of things, when you start looking into this, they sort of start bothering you. anyway, so we managed to get some funding, and then two of us went to, so two surgeons, unlike any other charity where the whole team goes, only two of us went, with the idea that we use the local expertise which is already there, educate the local people as well, and do some operations for the benefit of those children. And we started like that. We started with about 5 cases, and then the following year they would invite us, to the point that we are doing almost 20 cases in 6 days, which is quite a lot of cases for cardiac surgery, especially when only 2 people are going. And then part of that, we started inviting A-level students to come and visit, to inspire them to go into medicine, or not only in cardiothoracic surgery, but going to medicine. Sanjini had come over, and that was part of her sort of insight into medicine, and then whether this is actually for her to carry on into medical school or not. And that's obviously that she decided that that's medicine was what she wanted to do. And it is hard work, because then you have to overcome some challenges in the other country. You need to make sure that you're not depriving those surgeons. You imagine you're going and doing an operation, there's a surgeon there. Are you denying that surgeon their salary because you are going and doing that operation? So there are lots of things that come into play, and you need to be mindful of that. Then you also need to be mindful of the cultures, various cultures. And this is something that you start learning. How can you deal with, how can you convince a nurse there to do an operation compared to you're convincing a nurse to do an operation here? How do you convince an anesthetist there to do certain things, work with you, compared to anesthetists working here? So there are lots of things that you get to learn. It's not only are you doing an operation, but you're learning other things as well, how you're dealing with people. And what other thing that it helped, certainly for me, was it helped me become a bit more resilient when I came to my surgery. So when we are there, the equipment they give us are not the best. So you have to do with whatever equipment you have. So when you come back to UK and you're in your hospital, then you realize that if you don't get the equipment that you want, you can still deal with it, rather than saying, this is not my instrument, this is not what I use all the time, and start stressing about it. You can deal with those situations where the nurse has given you an instrument which is not yours because your instrument can't be found. So you can deal with those sort of things. Then also in intensive care unit, you're managing patients and they don't have certain things, certain drugs. How do you deal with it? How do you think differently? Same thing you can bring back to UK, and I think you become a bit more resilient, and it helps you in your day-to-day working in that National Health Service.
Yeah, so you mentioned sort of how I came to Kenya to help you with the charity, but and that helped with my insight. But what other advice do you have for med students? Do you think they should do sort of placements like that in their own time, or any other advice?
Yeah, so for people who are in medical school, if they have an interest in a particular field, so for argument's sake, we take cardiothoracic surgery, then they need to find placements that they can go and experience that. Not only the special study modules which are in medical schools, but a bit more sort of involved. And when you go to those special study modules, or that time you spend in that specialty, don't just go there for the sake of, or I want to go and see how they do the operation, how they look after patients, and tick that box. It is also take that opportunity to undertake some audit project or quality improvement project, or try and do a case report. You'll always find some interesting cases and try and do that. So that way you are getting the best out of that 4 weeks or 6 weeks you're going to be spending. and not only from your placement, but also from the audit project. Because if that's what you really want to do, then you need to make the most of that time you've been given in that placement. But try and find some other time as well. So we've got some students who come to us when it's their summer break. They come to us and spend some time. And recently I've had one student who came to us, did an audit project, and now is presenting in one of the national meetings. So it's just a matter of making sure that you utilize that time, not only for theatre time, ward time, but also for other things as well.
Another quick question regarding advice. When I was younger, wanting to be a medic, the advice I was given to prepare for the grueling onslaught of application interviews and eventually getting into medical school was to read as much as I could, to read about the news, to read about specialties that you were interested in, to get as much of an insight into the field as possible. However, I know a lot has changed since I applied. So what I would like to know is how our medical students can prepare. I know that you must be quite knowledgeable on this topic, so I was wondering if you could give us some insider info.
Things, the goalposts keep changing, isn't it? As you go through, as I said, when I went to medical school, I had my journey into medical school was slightly different than normal. However, what we used to advise people before and what we advise them now is completely different. In the past, people used to be asked in an interview question, some abstract questions, which no longer happens. So everyone is asked same question, and so there's no deviation from that, which in some ways is good. In some ways, you can't get to figure out the other person's personality and all that, right? You're just getting same answers from everyone because everyone has practiced that. So you can imagine everyone is practicing the same thing that you're going to practice. So you need to stand out and as you said, read not only about the topic, but read widely in the sense that not only about medicine, not only about what's happening in the National Health Service. You need to know about those things, but you need to start reading about things on team working, because that's a big thing in healthcare now. How do you work in a team? How do you get the best out of teams, right? And then if you start reading about those sort of things, we'll sort of start putting you aside, because when you ask something, you can always start relating back to what you've read. And if you've read something different than, oh, I've read about this latest drug that has been developed to cure COVID, right? Everyone has read about that. But if you read about how do you improve team working, how do you improve how are you going to get rid of poverty in some underprivileged countries, you can start thinking about, oh, I read about poverty in say some country in Africa, but how are you going to implement that in the National Health Service? How are you going to make sure that there's efficiency in the National Health Service? You see what I mean? You can start connecting things together. And once you start reading and then start connecting things together, that will stand you apart from the standard. I sit in interviews and I know one after the other. They're all standard answers. But when you can straight away tell the difference when someone is connecting different things together. And you can only connect those different things together if you're reading outside of medicine as well. Because there are lots of things outside of medicine that you can bring into medicine.
So it isn't as much about researching for the best possible answer, but much more about framing yourself in a different light from everyone else, because everyone else will have the same sort of best answer already memorized, thinking outside the box with things that the interviewers haven't heard of. Is that what you're saying?
That's and what that does is that, yes, when we're marking people, we have some things that we need to tick off. Yeah, they said this and this, but if you're sitting from my side when we're interviewing, those things can be ticked off very, very quickly. You see what I mean? Because but when you start bringing other experiences into it, that will straight away stand you apart. and say, this person is different, and they are really well read. They've done, they're different from that other person who gave me bang, bang, bang. Yeah, I've ticked everything. But what's the difference with this person? You're adding extra to it. And in the business school, they used to say, how are you going to add value to that question, right? How are you going to add value to my department? That's what they're going to ask. So, and 1 + 1 is not always 2 when you're adding value. 1 + 1 should be equal to 4 in some cases, so that that person who can make it 4 will stand out.
I just have one question that's just been dropped into me just before we wrap up. You mentioned that cardiothoracic surgery is a constantly advancing field, with smaller and smaller cuts for the same operation being instituted every single year. Different instances of AI and robotics are already being used in the field, constantly advancing with time. Do you ever think, though, that AI can ever fully replace the human surgeon, or will there always be a need for a human in the operating theatre?
If you look at, we used to say robotic surgery, but then we've changed that term to robotic assisted surgery, because there's always going to be a human person. It's like if you take a car, the self-driving cars, there's always going to be a human involved with that self-driving car, right? So when it comes to medicine, even if you take radiology, there are programs that can read X-rays for you. And they are more accurate than the experts reading it. However, when they detect an abnormality, that then has to be verified by a radiology. So if you train a program at the moment, things may change in future. If you train a program at the moment to identify a cat from so many pictures, it will identify a cat for you. But if it's not a cat, it will not tell you that this is a dog or this is a horse. It will only identify the cats for you. Yeah, so that's where we are at the moment. So the artificial intelligence is getting so clever that it can identify those sort of things. However, we feel that that surgery is advancing. There is a role for artificial intelligence and advanced learning, but there will be a role for the surgeons all the time. But that surgeon will have to be moving along with this advancement. So there will come a time where you could be sitting, not actually in the operating theater. You could be sitting. You have 2 different operating rooms, and you've started an operation here and you're just keeping an eye and making sure things are going well. But the surgeon will be there controlling. The skills of a machine are better than the skills of a surgeon, in the sense that if you look at the robot we have in cardiac or thoracic surgery, can move in so many different dimensions. A human hand can't do that. So we need to use those tools. So it's a tool that we need to use, like how we use scalpel and forceps. We'll be using robots as such, artificial intelligence as such, to make us become better surgeons, better doctors, rather than them replacing us. You see what I mean? There's a subtle difference there.
Okay, so I just wanted to thank all 3 of you for taking time out of your really busy schedules to come and sort of help spread some insight into this field, and also thank anyone who tuned in. Hopefully it's been informative for you, because I know it's been very inspirational and informative for me. But just as sort of one last quick question for Sanjani, how is seeing your dad progress and sort of dedication to his career, but also to his family, and sort of having a good work-life balance, how has that inspired your motivation? How has that impacted you?
Yeah, so it has helped me, because medical school is not the easiest thing to go through, but I have the support around me to help me get through. And obviously, like, I know that my dad's been through it, and he's probably had to go through a tougher time than I will, like being someone come from Kenya and doing all those other things. I mean, medical school now compared to medical school back when he was there, it's very different. They have their own challenges, which I'll have that my dad didn't have, but he also has his, that obviously I won't have. But it's like quite inspirational to have someone, you know, so close to me, have been through it, and yeah.
Thank you everyone for tuning in, and I'd just like to offer another set of thanks to our 2 guests of honor. It was an absolute pleasure having you both today. Thank you so much for coming.
Thank you.
Thank you.